One question that's certainly going to come up if you become the NDP leader is this backdated memo.
Yes.
When you were the principal secretary to Glenn Clark. Some people on our website on straight.com will comment and say, Adrian Dix cannot become premier because Christy Clark or whoever is, Liberals are going to slice them to shreds on this. What's your response to people who have that concern?
My response is I made a mistake. I owned up to it. I paid a price for it. Since then, I was executive director of Canadian Parents for French. We had enormous success funding French second language education. I've been an opposition critic, had great success there. I've been elected twice to the legislature. They raised the issue then. And if the BC Liberal Party attempts, again, to campaign on the 1990s, they are going to be defeated in the next election. I mean, we are going to present a program that is going to contrast to their program. They're a tired, discredited government. They failed on the issues. Christy Clark was probably the worst minister we've had in 25 years. She left politics.
Why do you say that? There have been a lot of ministers.
Well, there have been, but consider the record. I mean, I know some people want to mention, there's some other famous people from the past who didn't do very well, but consider the record. I mean, public education. She was Minister of Education. She was Deputy Premier at that time. And there is nobody, I think, in the education world who thinks she improved the system. Yes, she attacked teachers, but she attacked everybody. And the system was worse off as a result, demonstrably so, after her years as minister. She becomes Minister of Children and Family Development, right? In the spring of 2000.
Like a cup of coffee there.
Well, she was there for 8 months.
Yeah.
That was a critical 8 months, and you just need to read the reviews of that period to understand what a failure the government was in that period. They focused the largest cuts on at-risk children. They used the confidentiality afforded those children to hide the impact of their cuts for a long time. We had to expose it after the fact. So Christy Clark versus me, style versus substance. We made substantive change from the opposition side of children and families. She was minister for 8 months. She failed utterly in a critical issue to do with families. Families first, right? That's her slogan. Well, she was Minister of Children and Families. Then she quit, saying she was leaving politics forever, only to run for mayor of Vancouver, 8 months later? So that's the record. And I look forward to that debate of style versus substance. I look forward to it.
Did Glenn Clark, as your boss, ask you to backdate the memo?
No, I'm the one responsible, and I take full responsibility for it.
Okay. Final question. You have type 1 diabetes, very challenging disease.
Yeah.
How has it affected you as an elected official?
I think
how you do your job?
I think as a person, it's made me more disciplined than I was before I had it. Strangely enough, I think it's helped me in many respects. I was in great physical shape when I got type 1 diabetes. I was 28, so it was juvenile onset, but I got it much later in life. I was training to run the Seattle Marathon at the time, and I ended up running it the next year after having been diagnosed. So four days later, I was supposed to run the Seattle Marathon. I was diagnosed with type 1 diabetes. And so what it forces you to do on a daily basis is ensure you eat regularly. It ensures a consistency that wasn't my way before I had it. Strangely enough, I would go without eating. I would be working all the time. I'd do different things. It's forced me to be more disciplined and more thoughtful. I think.
So how often do you test your blood sugar levels every day?
A couple of times a day. I'm not as good as I should be. I inject insulin 3 times a day at the moment. At breakfast, lunch, and dinner. I have long-acting insulin through the day. I think the quality of insulin has improved a little bit since I've become a type 1 diabetic. Since I've had type 1 diabetes, it's improved things. But I think in general, it's also opened me up to a world of people with diabetes who struggle and work, and I understand that world better. It makes me more committed to addressing issues of equality because look, I've been since I worked for Glenn Clark when I was diagnosed. I worked with people who are a very caring, very generous workplace always. I've had good jobs. I've never gone into a grocery store, never in my life, and not bought something because it was too expensive. And really what you're doing with type 1 diabetes is artificially presenting or injecting the insulin that your body would normally produce to digest food. Right? So it's a balance of good food and the insulin. And when you have enough money to buy good food, then you're able, of course, to do that much more easily. But if you were working in a trade line at any of our public hospitals where people's salaries were cut and you had type 1 diabetes, you'd be more likely to go in hospital, more likely to go blind, more likely to lose a limb, and more likely to die earlier. And we've got to change that. I mean, the social determinants of health, how long we live, how we get access to good quality life and good quality food. Those are critical questions in healthcare. And the growing inequality of our province for people with diabetes, it only, I think, magnifies the differences between people. And we've got to reduce those differences. Healthy societies are more equal societies. All the international evidence
As Premier, what would be your #1 priority then?
To reduce inequality. That's the #1 priority, to ensure that every child has an opportunity to fulfill their dreams in life. I'll just give you one really practical example. You know, there's this great study that Harvard researchers went out around the United States and they asked people, they did a study of people who didn't have health care. 40 million people at the time, the numbers vary, it's between 40 and 50 million people. They said, what would you do if you had health care? And many of them say, well, I get my teeth cleaned or my teeth fixed. That's what I'd do if I had health care. Now in BC, we have an American-style system of dental care. So that under the premium assistance limit, children have access to a program called Healthy Kids. But there's dozens of communities in BC, dozens of communities where there's no dentist who takes Healthy Kids clients, right? Because they pay 60% of the dental term. So you have all the children who are below the premium assistance line, many of whom don't have access to good dental care. And then all the children between that line and the low income cutoff, which is generally seen as the poverty line, who have no access at all, no public access. And so the difference between them and everyone else is enormous. And think of it in terms of your life. We know that good dental care extends life. We know this because the evidence tells us this. But it also has a huge effect on quality of life, on getting jobs, you know, on interviews, on whether you work in the front of the store or the back of the store. And that's why we've got to extend and reduce these inequalities in our society, which are growing. And this government has been reprehensible on this question. The minimum wage has been lowered, right? HE members were laid off and their salaries reduced. We've seen a dramatic increase in inequality. And as Premier, I'd do something about that.
Okay, thank you very much. I've been speaking to Adrian Dix, the NDP leadership candidate, and also the NDP MLA for Vancouver Kingsway.